Good evening, everyone here. So welcome to Advancell webinar series. Myself, Dr. Lipi, I'm a Vice President in Advancell Group. So today we'll be discussing the rejuvenation, especially in the aging stage, and what are the natural biologics already in your body there, and what are the issues during aging, and how we overcome through the natural biologics. So here you can see one image here. So there is the aging, definitely is a natural process. So natural aging, but sometimes it's not natural or grace, we can say. There is a frailty, we call it aging frailty. And in between the disease occurs. So you can see here the common aging frailty, we more discuss in the subsequent slides. And this causes the different reason behind it, inflammations, metabolic alteration, and is causing the different, you say frailty, we say aging from the we can say aging frailty. So we have a weakness, weight loss, some hormonal imbalance. So this finally, we end up with the diseases, either death or dependency. So we have to avoid it. We have to learn more about the aging frailty and how natural biologics, we all already in our body, can help to prevent this. And we have a natural, or you say, graceful aging. So the topic of today's seminar, or you say webinar, rejuvenating strategy for stem cell-based therapy in aging. So objective of this is to learn more about the natural biologics, and also we learn about the pathobiology process of aging fertility and how the natural biology, especially the stem cells as a novel biologic, can be used for treatment of aging frailty. And because aging frailty is the biggest threat to successful aging, so we need specific interventions to be to improve the quality of life during aging. So, and cell-based therapies emerging as an innovative approach for several degenerative diseases. Among them is mesenchymal stem cell therapy in regenerative medicine. So natural biologics heal, restore, revitalize, replenish tissues, your organ. Actually, it's referred to the treatment option that help enhance body natural ability to heal. And because we all born with the components which require to initiate healing or recovery in your body. These are cells, cytokines, proteins, collagen, elastin, hyaluronic acid, and many more. I've just listed a few of them here. And because at the time of birth, these components at the highest abundance in your body, but will continue to decline as we age. So lots of reason we study, we will go through other slides. Intrinsic factor, extrinsic factor, we reduce these abundance. So you can imagine how the fast children recover from injury versus the adult, right? So because we are decreasing with the natural healing component as we age. So natural biological comparison chart that is already known, platelet-rich plasma, bone marrow, adipose-derived stem cell, amniotic fluid, water jelly, and exosomes. So you have just listed here to show you to measure advanced injuries. You go for the water jelly and exosomes. It's your choice whether you go for the autologous or allogeneic. Autologous, if you are not very much aged, it's okay. But if you're aged, no need to go for it because already you have exhausted stem cell in your body. So at that time, allogenic or donor stem cell is more recommended with the exosomes. Exosomes is the product of the stem cells. This is cell-free system. We'll little bit have this knowledge in the subsequent slides. So first come with the main issue during the aging is the aging frailty and what is the pathobiology, because it's a complex genetic syndrome becomes more prevalent in advancing the age because it's disrupt the physiological homeostasis and progressive decline of health status. Multiple factor, including the genetic genome instability, DNA damage, epigenetic alteration. This is all happening in your body, and stem cell exhaustions. So this can be little bit overcome with the progress cell-based therapies, especially mesenchymal stem cells. We will see in many clinical trials going on for this, and reduce the aging frailty, and it is under clinical 1 and 2 trials in human subjects. You see here the green line is healthy aging, but due to aging frailty, you see there's the dependency, end up with the dependency. So according to the WHO, healthy aging is a process of developing and maintaining functional ability that enables well-being. But due to the aging frailty, we reduce the mobility. We'll see so many other symptoms, weight loss during this in aging frailty. So here you say risk factors, which are aging, genetics, lifestyle, environment, and disease, maybe childhood disease, anything that is causes the chronic inflammation in your body. This is the major factor changing your muscles, endocrine and organ and heart also. And this changes give rise to weakness, weight loss, then exhaustion, and slow performance at this age, during when we age. So that what the outcome of this? That is maybe you have disabled or sometime fall, maybe end up with the surgery or death or dependency. So it is important to know about this, what is actually aging frailty, that is, what are the symptoms. So mean loss of muscle, stamina, endurance, sometimes weight without any reason, and or any chronic disease, especially the physical activity is very slowed down and low performance. So there's this two model described in aging fertility, aging fertility, that is phenotype model, that is unconditional weight loss, weakness, slow walking speed, low physical performance. The other is the deficit model, the accumulation of individual impairment that may be some disease, symptoms, or signs of disability. So as more specific, if I go, that is generally this cause of the genetic changes or genomic instability, DNA damage, or epigenetic alterations, or loss of proteostasis. Minsky, loss of proteostasis is the rate of protein degradation and protein mission, that is the imbalance in your body. Maybe accumulation of more protein, some cases of like Alzheimer's, in those disease, that is disturbance in the proteostasis, and oxidative stress, chronic inflammation, or mitochondrial dysregulation. And these may be called stem cell exhaustion. I mean, completely exhausted your stem cell at this age. So this is the progression of your aging frailty. And during this aging, in this stage, what happened? The secret inflammatory cytokines, chemokines, that growth factors, and collectively these molecules, and which are especially called senescent associated secretory phenotype, which is lead to the chronic inflammation and age-related tissue deteriorations. So, and this SAP, that is the secretory phenotype, which is senescence associated, which reduces the regenerative potential of your stem cell in your body, and definitely end up with the stem cell exhaustions. So earlier I mentioned the intrinsic factors and extrinsic factor for aging of stem cells. That is telomerase shortening, some genetic changes, or epigenetic. There is a more, if you go for more basic, so the loss of INK4A silencing in your DNA that cause the intrinsic mechanism that be causing the aging. The extrinsic is the more potentials, oxidative stress, and extracellular matrix deterioration, niche deterioration. This causes this, leads to aging fertility, and there is exhaustion of, you say, hematopoietic stem cell I have just mentioned here, so that due to this aging, you have lost, the basic is the hematopoietic stem cell that is present in the bone marrow, that is you, because they reduce the regenerative potential, that is like you say less homing or repopulation potential, so decrease down due to this intrinsic and extrinsic reason. Other factor is disturb or dysregulatory growth factor signaling. Inside your body, lots of signaling going on to do the special work at cellular level. For example, in skeletal muscle, there is a fibrous factors or TGF beta signaling, which is going very basic, and coupled to decrease the expression of Notch ligand in the myofibril, also decreasing deposition of extracellular protein. So this fibromycin. These changes contribute to the less regenerative capacity in the muscle cells. So thus, be affecting the satellite cell functions. And also the disturbing the quiescence of the old satellite cells as well. Yeah, this is a slide showing the different organ stem cell aging, and in every organ, you say muscles, neural, also that is aging, brain. So this slide showing different stem cell aging in different organs. Another term is the cellular senescence. This is which is the state of irreversible cell cycle arrest that can be induced by a series of stimuli, prominent aging organisms like telomere dysfunction, genomic instability, oxidative stress, and oncogene activation. And this accumulate with the aging. To be noted because it's accumulated with the aging in the several tissues. And this causes the pathology. And this also mentioned the stem cell quiescence is tightly regulated in our body. That means whenever injury occurs, how this quiescence come activate. This is tightly regulated, but it is disturbed. So the progenitor cell in your in the niche, stem cell niche, is not able to activate at the right time at the right site. So this disturbance also delay your recovery. So age-related inflammation, it's going on continuously in your body. That is because you have the bacteria in your gut. So they generally use metabolites, and these also cause inflammation in your body, and this inflammation causes cellular senescence and the stem cell exhaustion. So this aging impairs stem cell function both directly or indirectly through impairing the function of differentiating, because stem cell has the property to differentiate in different cell types. Sorry. And so we are designing, I mean, the science has having strategy to develop the strategies for regenerating therapies, like including systemic or localized treatment with rejuvenating factor directly or indirectly to restore your stem cell functions. Maybe when it can be outside, when you collect the from the patient the aged stem cells and rejuvenate in vitro and reimplant. This can also be possible. So I have listed some of these regular factor molecules already studied in the animals model, Like, for example, JAK-STAT pathway, that is the signaling, a very important signal for your growth. So paradox 6, this is the therapeutic molecule has identified and already tested in um, local injection on skin. So this is already studies going on that. Other important is inhibition of P38 MAP kinase and antioxidant that cassin, inhibition of CDC42 activity. So these are pharmacological inhibition of these molecules. Decreases the expression of cell cycle inhibitor and enhancing the regenerative capacity of stellate cells, especially in the muscles. So similar JAK-STAT pathway and cassin. These effective molecules already studied in animal model for their efficacy. So two major concerns arise with these intervention about these molecules, that these often important physical regulators for regeneration and then acute activation is critical for regenerative success, but the strategy should be aimed to modulate this pathway to avoid the chronic activation rather than complete suppression, right? So other also we have to in-depth knowledge of effective molecule, because when you give local, so it may affect the other cells. So we have to study the signaling pathway of these molecules to ensure the possible side effect on other cells. This is also very important before into the clinical practice. So little bit more basic, what are others? Natural biologics are the stem cells. As you all know, that is every organ having the stem cells, which is very specialized stem cell, and and uh, and is continuously replenish your organ, like you understand skin, hair, and all blood. So I have three important properties, that is self-renewal, differentiation cell type, and plasticity. It can be differentiate in other cell types. So you all understand the embryogenesis, and so because here you see this after day 3, totipotent cells arrive, because we had different term. We have used totipotent cell, pluripotent stem cells. So these inner stem cells are at day 6 or day 4, that is have the pluripotency, and we generally for experimental purpose, this is actually embryonic stem cells. So that is starting is the totipotent cells. Already I told you that the zygote, after zygote formation, then pluripotent stem cells, and the multipotent more safe because it's specific, easy to harvest, no ethical issues, and no teratoma formations. And other stem cell that is one important already in 2006, by Yamanaka, induced pluripotent stem cells, because he convert the mouse neonatal and adult fibroblasts by adding the pluripotency transcription factors. So I'm talking about more on water and jelly derived stem cells, that is the mesenchymal stem cells. And these are water and jelly. Umbilical cord, everybody understand, this is during the birth of the baby. There is the connection between mother and the baby. The cord, we call it umbilical cord. This umbilical cord having the water and jelly, which is tremendous, you say, enormous amount of stem cells present in that cord. So this is more anatomy of that, not going detail, but water and jelly is this area. So characteristics of mesenchymal stem should be, it can be differentiated into adipogenic or adipogenic fat-like cells, or bone-like cells, or chondrocyte differentiation. And this is the different culture methods of doing isolation of mesenchymal stem cells. And also under International Society of Cell Therapy should be flow cytometry for that mesenchymal is very important, because it should be more than 90% to be for clinical purpose. And also the doubling time of MSC is very important. So we have to be very sure about before use. Exosomes, I told you that is the part of the, derivatives of stem cells. Actually, it is the nanoparticle, about 300 to 1 nanometer, is vesicles, and they contain the RNA safer, more safer than the stem cells, and more potent and effective because it contains more growth factors. So I really want to highlight this exosome role of senescence. I talked about the cellular senescence, and especially skin cells. So this is the pathway they follow, MAP kinase and AKT. This is more molecular basis. I don't want to go in that detail, but it's reduce the senescence with this signaling pathway and decrease the senescence. So it's very important for the skin. So we Advancell having the exosomes that we call Advancexo for skin rejuvenation kit. And you can use and you can enjoy your youthful skin because it's helped you more collagen synthesis production due to this, because exosome help in that, and also reduce the inflammations. So further, we'll study, we'll talk about more about the exosome acid therapy for action of aging frailty, which is very important before end up with the dependency or any kind of surgery. So aging brain, it is more important organ is the brain and cardiovascular, heart, and sarcopenia. That is also one of the problems during this aging, that is loss of muscle cells. So is already talked about the aging brain. So we can lose the cognitive, there is impairment with cognitive decline. So which is very important. During aging, so we have to be careful about, because we are in development of physical fragility and great impairment during aging. So MSC already well proved that it has a neuroprotective effect on MSC. You can see here, neurogenesis help in the growth factor and also reduce the inflammation, because inflammation is the main cause of your chronic illness in your body. So this inhibites the inflammation basically and improve your cognitive, and also the stability of the cells. Because there is during the aging brain, there's a plaque deposition start occurring. So it's all can be prevented with the MSCs, mesenchymal stem cells. Other is the muscles. We are losing the muscles with the age, as you all know that that term is sarcopenia, and because MSC help to include inhibition of the muscles apoptosis and also reduce the chronic inflammation. That is very important to activation of the resident skeletal muscles. So MSC is a good source as a protective source for these muscles. Other is the cardiovascular risk. Because there is evidence showing that the cardiac disease, including myocardial infarction, atrial fibrillation, chronic heart failure, during the age. So this will help this, and this kind of risk is give rise to physical disability and muscle inhibition during when we age. So MSC has the cardioprotective effect. So they say that will help in the muscle strengthening, and there is in fact, reason that can be rejuvenated with the MSC cell because it has a paracrine effects. It can growth factor can rejuvenate that muscles, heart muscles. And also during aging, we have altered hormones and disturbance, the endocrine system, imbalance of metabolic homeostasis. And this is very important because this is age-related issues. So MSC also help in hormone balance because it's increase the density and also the lean mass, and the fat mass reduce with that because it's balance the hormone balance in your body and bone density. So stem cell administration may be effective for these changes during aging. So many clinical trial I've just listed here going on this aging frailty with the mesenchymal stem cells. It is in phase 2 clinical trial, and so far no severe side effect has been reported. And because MSC chosen for allogenic MSC, so donor mesenchymal stem cell that is from the Wharton jelly is selected. Because due to the anti-inflammatory response, reduces the cellular senescence, because I told you about the exosome as well, it's helpful because all its stem cells derivatives, and reduce the oxidative stress and stimulate the proteolysis response. This is very important. But what are the challenges during the MSC? Efficacy is very important, and because there is a limits of the autologous MSC application, and also during the MSC expansion, there is a shortening of telomerase, so we have to choose the MSC for early passage stage. This is all the culture techniques we have to look for before going for any treatment, right? So, and safety concerns is also important because long-term expansion, I told you, chromosomal abnormality in these cells can be possible. They can generate tumors. So we have to be very careful about choosing the MSC for therapy purpose. So also the paratene effect of MSC play important role at the bioactive secretions, that is exosome, there's good efficacy and safety. And already told you about the exosomes and cytokines can avoid the risk of genetic instability. So overcome of the stem limitation of stem cell, exosomes are there. So to avoid the risk of genetic instability, what I'm talking about, the telomerase shortening. So exosome has no issue in that. So this is we overcome with the exosomes. So this have a safe, effective agent for the regenerative medicine. So conclusion with the future perspective that worldwide demographic shows to shift towards the population with increased life expectancy. That is definitely there. And multiple pathological changes develop with the age, like DNA damage, chronic inflammation, maybe contribute to aging, some your endogenous stem cell exhaustion. And this will be the process of aging frailty. And this a frail patient may display disruption of physiological homeostasis, the decline in the function of several organs, especially heart, muscles, and the brain. Immune privileged state and anti-inflammatory property of MSC-based therapy promising tool for this kind of issues. We can take care of that. And especially allogenic MSC is successful to treat aging frailty. It is already phase 1, phase 2 clinical trials. And MSC could attenuate symptom of frail patients. And so far, no serious events have been reported. Take home message. So extraordinary advance in medicine and public health contributed to increase the life extension, definitely good trends. So, but age associated illness increasing, like Alzheimer's and other disease. Diabetes also giving impact on patients, family, entire healthcare system. So aging process is complex by highly iterated process. So This could be, I mean, say with the pleiotropic mechanism of action will be required for preventing and treating both aging and related disorder. Mesenchymal stem cells have multiple mechanism of action that can highly promising for this kind of issues, because these cells have highly safety profile for clinical use, and especially allogenic cells, we have to take little bit take care of their safety, because we have to choose those MSCs or which has early culture things. So we have to look for that before use. And also because not, this is very good because no matching required. So it's good for the transplantations. So that's all. Thank you. Any questions? I'm ready to take up.